A rare disease that only affects about 800 people a year in the US. A cancer that can be so fatal and affect people when they are so young. This cancer forms in certain types of nerve tissue and can affect all parts of the body. At diagnosis, this cancer has most likely already spread. This is the third most common cancer in babies, and the third most common cancer in children after leukemia and brain cancer. About 1 in every 7,000 children is affected at some time. About 90% of cases occur in children less than 5 years old. Of cancer deaths in children, about 15% are due to this disease. What is this disease? Follow me, Irma Lancaster, as we determine the who, what, where, when, why, and how of this life-threatening illness. Meet Lulu Thompson. Lulu and her family live in a modest house inside a modest neighborhood in Hyde Park, New York. Lulu is a fun-loving 6-year-old girl who enjoys friends, family, and gymnastics. Lulu has been doing gymnastics for as long as she can remember, and she can't get enough of it. Outside of the gymnasium, Lulu is quite soft-spoken and can come off a bit shy. However, according to Mom, Linda Thompson, when she is on the beam, all timidness falls away.
Lulu is always spinning, flipping, dancing around. Her spirit is infectious.
For the most part, Lulu is your average child, except for one major thing. Lulu has been diagnosed with neuroblastoma. Neuroblastoma is a type of cancer that forms in certain types of nerve tissue. It most frequently starts from one of the adrenal glands, but can also develop in the neck, chest, abdomen, or spine. We're now on our way to Janthe Hospital in Poughkeepsie, New York, to meet pediatric oncologist Dr. Harold Halverson to discuss Lulu's diagnosis.
Neuroblastoma is a tricky disease. Specifically, it can show up in many different ways. According to the examination, as well as Lulu's pathology report, the cancer started in her adrenal gland and spread to form a tumor in her spinal cord. In Lulu's case, neuroblastoma and similar diseases run in the family, specifically her mother and late aunt. Familial neuroblastoma for Lulu is caused by a rare germline mutation in the anaplastic lymphoma kinase, or ALK gene. In regards to her tumor, the MYCN oncogene amplification within the tumor is common. Unfortunately, Lulu is in stage 3, which means the chances of her recovery are slimmer than if we had diagnosed her sooner. Stage 3 for neuroblastoma means that there is a tumor infiltrating across the midline, with or without regional lymph node involvement, and in Lulu's case, a unilateral tumor with contralateral lymph node involvement. So, what are the symptoms that you noticed that brought you in here?
Well, first of all, she's been really exhausted.
Fatigue?
She won't eat.
Loss of appetite?
She's also been running a fever.
Fever.
Of course, we came in when we noticed the tumor. Lulu was having trouble standing and having trouble walking.
Do you have any other questions for me?
Well, just what specifically is going on?
Neuroblastoma most commonly originates in the adrenal glands, of 40% of cases with a localized tumor and 60% of cases that are general. Your daughter has also fallen victim of a myelopathy, which is basically just any neurological deficit that has to do with the spinal cord, and specifically she is experiencing tumor spinal cord compression because of the tumor. This only appears in about 5% of cases. Your daughter was very susceptible to the illness because she qualifies for many of the risk factors that fall under neuroblastoma, including her young age and the fact that this strain of the disease is hereditary.
Because of the diagnosis, all activities Lulu has previously participated in have come to a screeching halt, including, and most importantly, gymnastics. She began losing her hair due to chemotherapy, stripping her of her confidence and normality. Although the Thompson family is quite comfortable financially, the the expensive treatment plan, has taken a toll on their savings. This diagnosis saddens the family deeply because they do not wish the same outcome that their aunt had experienced for Lulu. Hi, doctor. Can you tell us a little bit about the possible treatment plans for neuroblastoma and why you chose chemotherapy for Lulu?
Yes. So the treatment plan for Lulu would include aggressive multimodal therapy, which could either be chemotherapy, radiation therapy, surgery, stem cell transplant, or immunotherapy. The family and I decided that it was the best for her situation to go with intense chemotherapy and attack the cancer cells. Chemo is a type of cancer treatment that uses any type of drug to attack any type of disease. Surgery or radiation therapy removes, kills, or damages certain cancer cells in specific areas, while chemotherapy works throughout the whole body. In 5 years of studies show that once undergoing chemotherapy, 47% of patients actually survived versus the 39% that didn't undergo the chemotherapy. And also, for Lulu's specific stage in which she is experiencing neuroblastoma, it is the most common type of cancer treatment. So, treatment hasn't really been going as we planned. The cancer has been slightly spreading to the lower back and to the throat. But me and Lulu are going to keep our hopes up, and we're obviously going to put our trust in the treatment. Let's see how it goes. As you know, Lulu Thompson has passed. She was a very remarkable case because she did get neuroblastoma after the age of 5, which is extremely rare, and she also had an extremely rare strain of neuroblastoma because it was hereditary and because it was familial. So obviously, just the fact that she lived with the disease at all was very remarkable. So don't forget that she did in fact fight hard, and that the treatment of chemotherapy does work and is very successful in 47% of cases. So just stay aware.
Thank you, Dr. Halverson. Lulu fought hard and vigorously for her life, just like many other people fighting with neuroblastoma and other cancers throughout the world. Just keep in mind to self-examine, go to the doctors regularly, keep yourself checked always. Thank you.